Hi guys, Dr. Carroll here at Movement Orthopedics. I'm an orthopedic surgeon. I'm going to talk to you a little bit today about partial knee replacement. This is an option for some people. It's an alternative to regular full knee replacement. So this is how it works. This is sort of a model of a knee. Here's your kneecap here. The upper bone's the femur bone. Lower bone's the tibia bone. For partial knee replacements, or we call them uni-compartment knee arthroplasties, we just replace the bad part of your knee. So that'll be just this tibial compartment here, this femur compartment here. We leave this side alone and we leave your kneecap alone. So this typically is less surgery, less rehab time, and a little less pain than a full knee replacement. So it's a good option. Not everybody can have it, but for the people that do get it, it's less pain, less rehab time, and works great.